Hello, wherever you may be. My name is Darren Brown, and I'm a behavioural optometrist based on the Sunshine Coast in Queensland, Australia, as you can probably tell from my accent. And I've got a special webinar presentation for you because I would like to show you how you can discover a way to conquer dyslexia and learning problems in your child and release their full learning potential. And as you do it, you can learn to escape the homework nightmare that so many parents around the world struggle with, all in 3 steps. So many people ask, aren't glasses enough? I see patients all through the year, through the school year and everything else. Probably about 80% of my patient base is children and young people. And people say to me, aren't glasses enough? Well, I'd like to think they were. If I could give you glasses that would cure your child of something like dyslexia or learning problems, I'd be in full favour of that. That would be awesome, but it simply isn't the case. See, the thing is, reading glasses or enhanced reading lenses, they help children to concentrate for longer without feeling visual stress. And we use these lenses all the time in my own practice. However, they do not catch kids up. That's the thing, they do not catch kids up. So people would have a child who's struggling in, say, grade 2. They'll get their reading glasses. They may see their concentration improve, but it doesn't fill in all the gaps that being a couple of years behind represents. So I was, troubled by this. I'd have parents begging me to help their child to just become average. Please help my child to catch up to the middle of the classroom. And perhaps you're like that tonight. But I've stopped aiming for that, quite frankly, because if we do this right, we should be able to help many of our kids to punch right through average and reach the top of the class. So my aim in this webinar is to show you how you can help your child reach their full potential, whatever that potential may be. So this webinar is for you if you have a child who's been diagnosed with dyslexia, learning disabilities, Asperger's, ASD, that's autistic spectrum disorder, somewhere on the spectrum, or even attention deficit hyperactivity disorder, ADHD, or anything like that. It's also for you if you have a child who struggles to concentrate on their schoolwork or is easily distracted. It's for you if you have nightly homework battles with your children, which often end in screaming or tears or drama. It's also for you if you believe that your child is capable of producing better work in school. And if you've been suddenly surprised by a teacher reporting that your child is underperforming or needs remedial help. This is quite common. You'll think things are sailing along for a couple of years, and then suddenly a teacher will come in and say, your child has a learning problem. You say, well, what did the last 2 teachers do? Teachers teach differently. Some of them pick things up that others don't. But if you've had that horrible experience of finding out that your child is struggling, then this webinar is for you. It's also for you if you've spent good money on treatments or tutoring with little or no improvement in the child's performance and results. We love our kids, we can spend money on lots and lots of things, but you need to spend money on something that's going to actually work. So let me give you a little bit of a rundown on myself and what led me to work with children with learning problems. So as I said, my name is Darren Brown. I'm a behavioural optometrist and I'm based on the Sunshine Coast of Queensland, which is a lovely place to live, suffering over here, but someone's got to do it. I graduated from optometry school in 1984, so it's a few years ago now, but I was soon dissatisfied with mainstream optometry practice, which is, giving reading glasses to old men and sitting in shopping centres trying to upsell, to people. I hated all that sort of stuff. So I got involved with behavioural optometry, went to my first seminar just a few months after I'd graduated, actually, and this completely changed my life. And I decided to study, and I completed a postgraduate fellowship of the Australian College of Behavioural Optometry in 1989. Then in 1990, I adapted vision therapy programs from other optometrists. But I just, frankly, I found that I had little or no success or impact. But then here was the crunch. In 1994, we discovered that my oldest daughter had a learning disability, Asperger's, and it became an enormous struggle for us. She's a beautiful, wonderful girl, but she just really, really struggled in school. And I found that my conventional therapies just seemed powerless to help her. We tried and tried and tried, and it was really a difficult road to go down. So for many of you, I can tell you, I understand where you're coming from. What I then decided to do was to start studying the vision therapy masters from yesteryear, because somewhere in the world of high-tech equipment and new ideas, we've overlooked some pretty basic and quite profound things that some of our forefathers discovered, and they've sort of gone by the way. So I kind of went on a quest to try and discover those things for myself. You may be wondering if we're talking gobbledygook here. I mean, am I a weirdo? You don't know me personally. Am I strange? Am I weird? Am I an outcast from my profession? The answer is no. There is now tons of evidence in the scientific literature supporting the role of vision and visual skills in learning. And there's tons of evidence on how the right type of vision therapy can dramatically improve learning and reading performance. But like I said, I didn't really like the traditional vision therapy exercises, so I decided to design my own. And I wanted to target school and learning performance, not my optometry measurements. When optometrists get together, we swap measurements. We say, this child was this and they improved to this. That's fine for us, but you don't want to see that, I'm sure. You want to see actual results in the classroom. So the question, ladies and gentlemen, is not whether vision therapy works. Of course it does. The question is, what type of vision therapy works best? I set out on a quest, as I said. I wanted to find help for parents of children with diagnosed dyslexia or learning problems, because I understand the frustration and the pain that you go through, and just the sadness as you watch your child struggle away. I wanted to find help for parents who just feel powerless to help their children. You can go to 100 different professionals. What you need is someone who tells you to actually do stuff. Not just gives you a diagnosis or a name, but tells you how you can overcome the problem. I wanted to help parents who are sick of watching their child struggle to learn. It's heartbreaking. They want to learn, but it just doesn't compute for them. I wanted to find help for parents who are tired of seeing their child's self-esteem shattered by schoolwork. When the kids come home and say, Dad, I'm dumb. The other kids are smart and I'm dumb. It just breaks your heart when you see that. And I wanted to reach out to parents who are experiencing that. Also, parents who are sick of fighting over homework every night. If homework is a drama, you are in the right place, trust me, because we can provide real solutions for that. I also wanted to help parents who genuinely believe that their child is smarter than their school results and want to do something about it. If you talk to your child and they're verbally good, or they're good at maths but they're not good at reading, then they're the parents I want to help, because we can, that's almost always a visual problem. So here is something to think about. 80% of children who are reading disabled, including dyslexics, have vision problems which can be solved. 25% of all children have a vision problem significant enough to affect their performance in school. So 1 in 4 kids is being affected by their vision adversely. 95%, this is stunning, 95% of first grade non-readers have significant visual problems. So these are the people who struggle to read. 95% of them have significant visual problems. In fact, they have nearly 2.5 times more visual problems than high achievers. In one California funded study, repeat offenders reduced from 45% to 16% when they received on-site optometric vision therapy. This stuff really works, and it can affect, as you can see in that study, their behaviour. School vision screenings detect only 20 to 30% of significant vision problems, and I think that's generous because most of them seem to miss the problems. Yet 1 in 10 children at least, and again that is very underdone in my opinion, is at risk for having an undiagnosed vision problem. And that's from the American Optometric Association. Here's a testimony from someone who's been through our program, and she said that she noticed her son's ability to focus on the task improve. And as they've gone through, his literacy actually improved. There's no quick fix here, but what there is a way ahead. So I want you to just stay with me and see this webinar through, because I want to show you the little known visual skills that can have an enormous impact on learning. Now, most teachers don't know about this. Most doctors don't know about this, but they're hugely significant. I want to show you the symptoms to look for and how you can discover if your child has vision problems. I also want to show you simple tests that you can do yourself at home to see if the effects of vision and vision problems, see if that is having an effect on your child's learning. I also want to show you how you can spend just 20 minutes a day doing the right sort of vision therapy and see your child's performance improve within 3 months. I also want to show you how you can do this in your own home without trained therapists, optometrists, or tutors. Now, some professionals will have an issue with this, but I don't, because if we lay this out clearly to you, you can do these techniques in your own home. Also going to show you how we can structure our vision therapy and keep you on track, and we'll give you some free ideas of therapies that you can do with your child right now. So, here we go. What are visual skills and how do they affect dyslexia and learning problems? Okay, any skills involving both vision and the understanding of visual information are what we term visual skills. And we learn to master them as we practice and develop. In fact, for most kids, we use visual skills and we develop them naturally as as a child learns to read, write, and spell. There's no mystery here. I mean, anybody can tell you this stuff. As kids learn, they develop skills. But most teachers skip the teaching of these skills and go straight to teaching kids how to read, which is fine if kids are getting all the skills and picking them up quickly, but if there's any sort of a blockage or any reason to sort of not pick them up, many children are left behind. And teachers don't even know about these skills a lot of times, but it's really important that we get the skills right before we teach them to read. Visual skills, in fact, are the tools with which a child learns. Let me ask you a question. If I said to you, can you build me a table, here's the wood, you'd say, okay, where's the saw, where's the hammer, where's the screws? Oh no, you don't get those, you just get the wood. Now, what sort of a table do you think you'd build? You need tools to do the job right. And in the same way, you need tools to read correctly. And many times, kids just don't have these tools. It's that simple, but we can develop them. The great thing about developmental problems is that we can develop them, and that's what we're talking about here today. So, we do this in many areas of life. We train in other spheres. So, for example, if you wanted your child to play soccer, we'll call it football for the Europeans, soccer for the Americans. If you wanted them to play soccer, you wouldn't just give them a jersey and say, go and hop on the field. It'd be embarrassing. You'd send them to soccer practice where they would drill the skills, how to pass, how to shoot, how to head, how to tackle, how to, all this sort of stuff. And once they've developed the skills, they will be a better soccer player. If you wanted them, for example, to learn the guitar or piano, you wouldn't just say, here's a guitar, hop on stage. Here's a piano, get out there and play. You would send them to piano or guitar practice where they would learn the skills. But the problem with reading is we just throw them on stage. We just throw them on the field and we say, hey, start reading. We haven't developed the skills they actually need to do the job. And it's in fact more powerful to train these skills separately and get them right and then let them start learning to read, because the skills will help them to pick up all the reading and the learning that they need to do. So they'll be reading and writing and spelling far more rapidly if we train the skills as a separate thing. There is no magic bullet, glasses or pill to do this. I'm telling you now, if you hear, oh, we'll just try these coloured glasses or we'll just try this special tablet, I think you'll be disappointed. But hey, don't give up, because there is a way. It just takes time and effort. I can't promise you a quick fix, but what I can promise you is tangible results. But one thing is for sure. Einstein once said, the definition of insanity is doing the same thing over and over again, expecting a different result. Well, how is that not remedial reading? I ask you. It's exactly what remedial reading is. And I'm telling you, the answer is not doing more of what they hate, hoping that one day, magically, the penny will drop and they'll improve. You can fight and claw and see some improvement as they begin to pick up skills, but if you train the skills separately, you'll see massive improvement. So there are 3 steps I want to look at in conquering visual dyslexia and learning problems. 3 practical steps. Number 1, get an eye test. I know this sounds crazy, but I want to, if there's a huge visual problem there, you've got to deal with it. So get an eye test. You may not be in an area of the world where you have access to really top quality eye tests, but we'll talk about that in a moment. You've got to start with an eye test. Number 2 is do some home visual skills testing yourself. If you can have a look at your child at home and say, hang on, this looks a bit suspect, you can know whether your child has a visual problem or not. And step number 3 is do something positive and proactive about it. In other words, find the right therapy program and see it through. So let's look at these in detail. Number 1, get an eye test. I would start by asking your teacher about your child's learning. Do they seem to be doing well? Are they behind? Etc., etc. Then go and get a professional, competent eye test. Now, most eye tests in most countries will look at the sight and the health of the eye, and fair enough. They will also tell you if your child is long-sighted, short-sighted, or if they have astigmatism. Not going to go into what they are now, but that's pretty much a basic eye test. The problem is that over 70% of the children I see aren't long or short-sighted, but they have a significant visual problem. So that sort of eye test is not going to be enough. 10 minutes in the local shopping centre or Walmart is not going to be enough to diagnose the sort of visual skills problem that your child may have. When I test eyes, and I don't expect all of you to come to Queensland for an eye test, you're most welcome to if you want to, but when I test eyes, I spend a lot of time testing focus and eye teaming at distance and near, so we can see ranges, we can see what reserves the kids have, how they're able to sustain things, whether their focus and eye teaming fatigues over time, all those sorts of factors which have a huge bearing on learning. We also look at a whole bunch of things like perceptual tests, eye movements, visualization, eye-hand coordination, directionality, to name but a few. How many of you, let me ask you, have had an eye test for your child and been told nothing is wrong? But you walk out of that place and you know deep down that that's not right. There is something wrong. But the professional couldn't put their finger on it. So the right sort of eye test from a behavioural optometrist would be far and away the best way to go. If you can find one in your area, fantastic. If you cannot, then it becomes more difficult. But perhaps there is still a way ahead. Let's get on to step 2. This could fill in some of the blanks for you. Home visual skill test. I'm going to start with a symptom list. And we can email this to you, get this to you. But I'm telling you, if you tick a bunch of things on this symptom list when I share it with you in a few moments, you can almost guarantee that your child has a visually based learning problem, and we can help. I'm also going to share with you a simple focus test, a convergence test, an eye movements test, and a memory test. Now, these are not conclusive. These are not comprehensive, but they will give you just a bit of an idea. So let's have a look at the sorts of symptoms a child with these sorts of problems will experience. The question I would ask you, mums and dads, is does your child exhibit the following signs? Red, sore or itchy eyes, particularly after reading. Jerky eye movements, or if you notice one eye turning in or turning out, particularly during reading. Do you see them squinting, rubbing their eyes, or blinking a lot, again associated with reading or homework? Do they complain of blurred or double vision? Do they get headaches, dizziness, nausea, or anything like that after reading? Now, you'll notice all of these sorts of symptoms are eye strain symptoms. This would indicate that your child's focus and eye teaming is becoming fatigued. Are they tilting their head, closing or blocking out one eye when reading? Sometimes they'll lean down, like they'll lie down on one arm and read with the other eye, but they're actually blocking one eye out to do it. Got to watch for those kind of little clever things that they come up with. Here's the big symptom. This is the number one that I see. Poor concentration for near work like reading. If you have a child, here's the bottom line, folks. If you have a child who can concentrate on a movie but not concentrate on their book, then you probably have a visually based learning problem. You see, they'll often get the label hyperactive or ADD or something like that, ADHD. But you can't turn ADHD off for watching a movie, then turn it on when you look at your book. But if your focus is relaxed when you're watching a movie and it is under stress and pressure when you're reading a book, then that's a visually based learning problem and we can help. Here's some more symptoms. Does your child show the following performance cues? Number 1, avoidance of near work. this is similar to poor concentration, but if homework, is like this. Okay, sit down, Johnny, do your homework. What are you doing now? I'm getting a drink. Okay, what are you doing now? I'm going to the toilet. Get back in. What are you doing now? I have to sharpen my pencil again. And all the excuses come out, and they're actually avoiding near work. That's a red flag to having a visually based learning problem. Do you see frequent loss of place when reading? Or perhaps they omit or insert or reread words or letters as they're reading. Perhaps they jump to the next line down. If they run their finger under the line, does their reading speed improve? That would indicate eye movement problems. Do they confuse similar looking words? Do they fail to recognize the same word in the next sentence? This is so frustrating, You tell them a word, you turn the page over, the next sentence, they don't know what the word is. It's like it fell out of their head. These are the sorts of symptoms we're looking for. Does your child perhaps show any of the following? Are they smart in everything but school? If they are, we want to know about it, because that would indicate that they're smart enough, they've got a good brain, but there is a problem with their reading side of things. Perhaps they're better verbally than when reading or writing, or maybe they're struggling with low self-esteem or poor self-image, or a real sensitivity to failure. If you get knocked down enough, it's pretty hard to get back up. And if everything you do in school is a failure, it's pretty hard for you to get enthusiastic about school-based activities, because the child just thinks to themselves, I'm going to fail. I can't do this. I'm hopeless. Do you experience temper flare-ups? Aggressiveness, frequent frustration when doing homework? If that's you, then we want to know about it. Or maybe frequent crying, especially during homework. I can't do this. This is too hard. If that's you, we could be onto a winner here. And once again, a short attention span or poor concentration. There it is again, our number one symptom, poor concentration span or irritability. You see, the kids often, they're trying hard. They're just as irritated as you are with the situation, just as frustrated. Maybe they're daydreaming. There's a lot of good kids out there who don't put on a big performance or scream or yell or cry. When it comes to homework, they just float away and they're off with the pixies somewhere. You might think they're thinking deep thoughts. They're thinking about food or something. Daydreaming is another sure symptom that you have a vision problem. Perhaps your child is frequently labelled lazy or told that they don't try. This is, tragic. I even have parents come in and say, I think my child is lazy, because it seems to be the only explanation, but most often it's not. Most kids want to do the right thing and want to impress mum and dad. They're not lazy on purpose. There's a reason behind it. Maybe you've got the label dyslexic. I mean, I'll be honest with you folks, we don't really know what a dyslexic is. The definition is moving and changing all the time. It used to be a brain disorder, and now it's pretty much any learning problem in some spheres. So don't fall for the old, my child's dyslexic, there's nothing I can do. If that's the case, I help dyslexics every day of the week. Don't lose hope if you've got that label. Maybe they're called ADD. And as I said before, they can't switch that off to watch a movie and switch it on to read a book. If it's coming up that way, it's most likely a vision problem. Maybe they've got the label slow learner, or that they have a behavioural problem, or even worse, juvenile delinquent. Maybe they're just told they're working below potential. If you experience any of those symptoms, then we would love to talk to you, because we think we have a way ahead. But let's move on to some of the other tests. Just quickly, here's a quick focus test. Hold a book with small print, 5 to 7 centimetres from your child's nose. Take a printed chart that we can supply to you, tack it on the wall 6 metres away, and get them to change from distance to near, distance near, distance near, saying yes each time, to do this 20 times. If it takes longer than 40 seconds, or if you hear them slow as they go along. So they start quickly, but they get slower and slower and slower, chances are you have a focusing problem. Eye teaming is another thing. This one, you can see this little boy here with his pencil. It's an easy one. Hold the pencil 50 centimetres from their nose, move it closer, and you need to be able to get it closer than 7 centimetres to their nose. But if you see an eye sort of pull out very dramatically when it gets closer, chances are you have a convergence problem. Eye movement test. If you hold a pencil 20 centimetres from their nose and ask them to follow the pencil Move it left, right, up, down, and then ask them to, move it in the Union Jack, so up and out, down and in, that sort of thing. If they have trouble following it, if you see their eyes wiggling or jerking or losing the target, or if they can't keep their head still, you may have an eye movement problem. What about visual memory? This one plagues parents all over the world when your child's trying to learn spelling. Here's a quick test. Write 2 series of the numbers 1 through 9 on separate pieces of paper, cut to the same size. Hold a book to block the child's view and place 2 numbers randomly behind the book. So not side by side in order, but up and down, that sort of thing. Remove the book for a second, then replace it and ask the child what the numbers were. Keep adding more numbers until they can, and discover the maximum number that they can remember correctly 2 out of 3 attempts. That just gives you a rough idea if they're having trouble picturing things in their mind with visual memory. And of course, this is heavily dependent on age, but it's not a definitive test. Don't get me wrong. I'm not trying to replace a behavioural optometrist in your life. I'm trying to just give you a bit of a clue as to, potential problems in your child. Now, the third step is really important. Do something about it. It's not good enough to test if we fail to treat. And so many professionals out there will provide you with a diagnosis but will not tell you what to do about it. Testing and diagnosing is completely pointless if you do not do something about it. Doing something is always better than doing nothing. In fact, if you do nothing, nothing will change. Guarantee, if you just keep sailing along with your child struggling at school, it's not going to spontaneously get better. I would always accept the do something advice over the nothing can be done diagnosis. Believe me, folks, if you go out there, you'll get a lot of nothing can be done diagnosis. Yes, this child has dyslexia or a learning difficulty or whatever, and nothing can be done. It's just the way they are. Don't accept that. I would try everything first. I think if you really love your child, try stuff. Don't give up on them. But here's the thing, taking the wrong advice will see you wasting time and money on therapies that look magic but do not work. And you can put literally thousands and thousands and thousands of dollars into this stuff. Not all advice, not all therapies work. So what does the ideal therapy look like? I mean, if I was going to design the ideal therapy, which I think I have, what would it look like? I think you'll probably agree with these. First of all, it's easy to join, easy to do, and has simple instructions. You don't want something you need to be a Rhodes Scholar to do. You want something that's easy. Secondly, it needs to be done in your own home with no travel. Now, this is going out across the internet to places all around the world. I don't know if you have a behavioural optometrist in your town or city. I don't know if you can afford to go to a behavioural optometrist in your town or city. If you're in the United States or Australia, you might have this. If you're somewhere perhaps in Europe or Asia or Africa, it'll be much, much harder. So the ideal therapy's got to be done in your own home, so you haven't got to travel somewhere. It also needs to take around 20 minutes per school day, and it should last longer than 9 months for guaranteed results. You don't want to be pounding away for 7 years doing a therapy that's not working. Most of all, the ideal therapy needs to be fun. Kids have to enjoy it, and they have to have fun while they're doing it. And vision therapy, of course, is like any other therapy. A little every day is far more powerful than an hour or 2 a week. But you need to see it through. You need to go the distance with therapy, not just do it for a week or 2 and give up. You've got to actually persist. And I'll tell you why in a few moments. And once again, I caution you because not all therapies are the same. Training visual skills is very, very powerful. Because if you train the core visual skills, you literally, and I mean this, you literally cannot fail to see improvement in your child. Because you're training what we all use when we learn and when we read. And I don't care if you're a dyslexic or Asperger's, ADHD, autistic. I've done this with adult illiterates. I've done it with refugees who are 9 and 10 and sitting at a desk with a pencil for the first time in their life. These things actually work, and they work with everybody, even if you have physical disabilities. Because if you're going to read, you've got to use the same skills. They work in all sorts of languages, whatever it is. You can do this in Chinese, you can do it in Hebrew, which runs from right to left instead of left to right. We all use some sort of visual skill as we are learning. In fact, I trialed these techniques and developed this special program up in Malaysia working with refugees. Bright kids who just never had a chance. And we got them going really rapidly using our vision therapy. My vision therapy works on this principle. You give your child a fish, you feed them for a day. You do stuff for them, they get it for a day. You teach them to fish and you feed them for a lifetime. And that's what developing visual skills is about. If you give the child these skills, the skills they need to learn, they will learn and they will never stop learning. And that's what a good vision therapy program actually does. It gives them the skills that they actually need to learn. Here's the thing. If you do something often enough, you train the skill until it becomes automatic. Fighter pilots know this. Ladies and gentlemen, you even know this. Let me just pause for a moment and ask you, when you learned to drive, if you're anything like me, I sat behind the wheel, I thought, my goodness, how does anybody drive a car? Put your foot on the clutch, you got your foot on the accelerator, you got to take the handbrake off, put the indicator on, you got to check your mirrors, you got to steer, Man, it just was so complicated. I was kangaroo hopping right across the car park I was practicing in. It was a mess. But within a month, after all this, after how hard it was to start, within a month, most people are driving with confidence, listening to the radio, talking to their friend in the passenger seat, texting on their cell phone, which you shouldn't do, all at once. Why? Because that very complex job of driving a car, you do it often enough, you train it so it becomes automatic. And that's what fighter pilots know. They've got so many things running through their mind, they're doing all this sort of stuff, but at some point it becomes automatic and they go on to become incredible pilots because the basic skills are automatic. That's what we've got to do with our kids. These visual skills need to be completely automatic, and then they can concentrate on learning other stuff once these skills are automatic. But while they're not automatic, it's like trying to drive a car. They're trying to do all these things at once, and it simply doesn't work. Here's another real testimony. And it's just great to get these things flowing into us. And here's one that I really like because it's quite... It sets out exactly how her child has done. Son went up 12 reading levels in 6 weeks. And that's not uncommon when kids do the right sort of therapy. So, let me recap on how you can conquer visual dyslexia and learning problems. Number 1, get a professional eye test. Get a proper eye test, preferably from a behavioural optometrist. Number 2, do some home vision skill tests yourself and check the symptoms. We can send you that symptom list if you like. And also, number 3, do something positive and proactive about it. Please do something about it, because the longer you leave it, the harder it is for your child. And here is what I believe is the best thing you can do for your child and their future learning. It's a program that I have designed from my behavioural optometrist practice here on the coast in Queensland, Learning at Lightspeed Home Vision Therapy Program. It's our exclusive program that actually trains the visual skills that your child actually uses when they sit down to learn to read, write and spell. It works through a developmental progression. So it starts with very basic skills and it progresses right through to advanced skills. It's no good being haphazard and learning a couple of advanced ones, then a basic one, then a mid-range one. That's a mess. You want to start basic, build the foundation, and then you want to progress and build upon that till you've got all the skills you need to learn. It involves games and therapies which are actually fun. And they're not only fun, they're highly targeted. They take only 20 minutes a day, school days only. If you incorporate it as part of your homework, it is a perfect situation. And it can catch up a child and in many cases advance them ahead of their peers by giving them an unfair advantage. If you're in grade 2, if your child rather is in grade 2, and you teach them skills that the rest of the kids in the class won't get till they're in grade 4, do you think that's bad? They'll have an unfair advantage. Wouldn't you like to give your child an edge, an unfair advantage over all the other kids in the class? I reckon that'd be pretty cool. Also, it's designed by a passionate professional, which is me, who has experienced the anguish that you are feeling right now. I know it, I understand it, I feel the frustration. It's been designed to target the visual skills that your child needs to succeed, not just my measurements. Now, my measurements will probably change, but that's irrelevant to you. You don't want measurements to change. You want to see your child improve at school. Isn't that right? Also, it's been designed with simplicity and fun in mind, because that's how you get kids to do activities. You make them fun. And so that's what we've done. And most of all, it actually works. I have got scores of kids, probably hundreds of kids, improving all over the place by doing this therapy. So what's the game plan from here, folks? How can we use this and this information to our own advantage? Well, we need to do the right techniques in the right order and to leave no stone unturned. We don't want to jump around. We don't want to gloss over stuff. We don't want to say, hey, this kid's in grade 4. They've probably got that one. What if they haven't? For an extra couple of weeks, we can go back and make sure that they've got that one. So we don't want to gloss over things and leave stones unturned. So in my therapy, we track right back to prep. Some of you will call that preschool. We call it prep here. And even pre-prep, to make sure that we miss nothing. We don't send them back to preschool, but what we do is we track back and we make sure those very, very early visual skills, very basic visual skills, and gross motor skills and all that sort of stuff are in place. So it starts very, very simply. But then we build the right visual skills layer upon layer, step upon step, doing the right techniques in the proper order. So finally, your child can gain the skill and the confidence to use it. Many kids with learning problems, they haven't got any confidence. They're used to failing. That will change as they work their way through this therapy program, because they will be stretched a little, but then they will see that they can achieve these things. And little by little, we build not only their confidence, but also their visual skills. So what areas am I talking about? I mean, we've been talking about visual skills. You're probably saying, what is this guy talking about? Okay, let me give you the areas, primarily that we work in. There are 7 key visual skills that your child needs to learn effectively. Number 1 is focus. Number 2 is eye teaming. Number 3 is eye movements. Number 4 is visualization. Then we've got laterality, hand-eye coordination, and finally, other perceptual areas. Let me run through what these involve so that you understand what we are training in these kids and the skills that we are giving them. Number 1, focusing. If your child can't focus, then if they can't sustain their focus, then they can't concentrate. So training focusing will increase their concentration for reading and for close work. It also helps them copying off the board. There's 2 aspects to focus. They've got to hold it for a period of time as they're reading, but then they've also got to change it from distance to near and back again when they copy off the board. We can train both of those. It also, if we train this, it relieves tired, sore eyes and headaches, and it improves comprehension and retention. Studies have shown that if there's adequate focusing there and the visual system is not stressed, then they can comprehend and retain information far more easily. And look, it makes sense. If 90% of your effort is put into just holding the page clear, then you have 10% left to understand and retain it. If only 30% of your effort is put into holding the page clear, then you have 70% of energy available to understand and retain the information. Eye teaming ability is quite similar to focusing. If we train this and train convergence, it increases concentration, it also improves reading flow, and it decreases double vision and generalized stress when they're reading. So if we train both of these areas, we should be able to get kids to concentrate for a lot longer up close and do a far better job. The third area is eye movements. If we train them, we can improve reading flow. We can decrease misreads or skipping lines. If your child moves from one word to the next word and they're not sure if it's the next word, maybe they're 2 words over, maybe they're a line down, we can train their eye movements to be more effective. This also helps them copying off the board because it helps them orientate when they're writing something up close and they look up the board. It helps them find their place again and they don't miscopy things off the board. And for many parents, this is also important. You can train their eye movements to improve ball sports, especially small ball sports like tennis, cricket, baseball, that sort of stuff, and even soccer. The fourth thing is visualization, and I love this area. This is probably my favorite area to work with. This directly affects, you know what? Spelling. And we'll look at this in detail in a little while. Training this will improve spelling. It will also improve their memory. It will also provide them with greater activity. It's incredible. Honestly, teachers spend so long teaching kids phonics. If you've got a huge sight word vocabulary, you never use phonics, except if you run into a word you don't know. So adults don't use phonics because they've got the vocabulary there. They've got all of those words in their head as sight words. I reason that if you can find a great way to put sight words in their head and pile hundreds of sight words in their head, phonics becomes just slightly irrelevant. Don't you think? Makes sense, huh? Number 5 is laterality. What is laterality? It's not just your left and your right. It's plotting out your space well, both within your body and somebody else's body. The long and the short of it is, it's how you stop them writing numbers and letters backwards. Reversed writing is terrifying for a parent to see, but we can stop that by training laterality and directionality. We can also train hand-eye coordination. That improves writing, and it also improves ball sports and that sort of thing. And we can also train the other areas. We do coding, sequencing, gross motor, fine motor. Pretty much, if I found any skill related to eyes, related to education and learning, I have put it in this incredible program. So, when you sign up for Learning at Lightspeed, here's what you get. Very clear instructions. We'll give you an example of this in a moment, but we clearly lay out what each exercise is trying to achieve and exactly how you do the exercise. We give you all the charts and the handouts, everything you need so that you can run off copies as you require them wherever you are in the world. You haven't got to go and get stuff. We give you record sheets so you can plot your progress. We give you email support. So, we're here when you need us. We can direct you and help you and overcome problems that way. But I'm sure you're saying, well, what is this stuff about? What does it look like? Well, here's a few examples of the sort of things you'll be doing when you join Learning at Lightspeed. This is a cool, we've actually got a computer game version of this, but this is the version we do on paper. This is called Capture the Mosquitoes. This is one of the more advanced plates. What you've got to do is circle each of the mosquitoes 3 times without stopping your pen. And you can time kids as they do this. So obviously you go 3 around 1, then they move to 3 around 2, then 3 around 3, and so on. And it's a lot harder than you think. But this is training eye movements and hand-eye coordination all at the same time. Here's another thing we do. This is one of our focusing exercises. You might want to try this at home. We are developing rapid and accurate shifts between near and far areas. So you get a letter chart, which we can provide in a book, and 2 pieces of cardboard, and there's the method laid out. So it's clearly laid out purpose, what you need, the method, and then variations. How can you change this? How can you make it a little bit harder? You can hold the book closer. You can add a rhythm or a beat to them, which is very important. Rhythms and beats are great. They're great for sequencing. They're great for putting pressure on tasks. You can do it while they're standing on a balance board or standing on one leg. There's all sorts of things you can do. Here's an example of a chart. One of the charts that we use, it actually looks a bit better than that. That's just an adaptation for this presentation. Here's another one, visual memory activities. Laid out objectives and activities, and this is just a small skerrick of some of the visualization training that we have in our program. Now, parents, wherever you are in the world, I'm going to pause right now. I'm going to ask you to join me in an experiment while I experiment on you. Let's try it, because it'll give you a good perspective on things. Here's the thing. We're going to look at visualization, which is one of the skills we use to learn spelling and sight words. So this skill has been pretty much lost on younger generations. Can you think why? Of course you can. Before I do the experiment, can you think why? Of course you can. It's the prevalence of screens we have. See, in the old days, people used to read to kids, or people used to listen to radio plays, so they would hear the sound, but they'd have to make the picture in their mind. Well, these days it's all done on a DVD or an iPad or something like that. Kids don't have to visualize until they get to spelling. So we can teach them this long-lost skill. So here's the experiment. Let's see if you've got it. Spell the word hippopotamus. Go. I can't hear you. Okay, I don't really care if you spelled it or not. That's how you spell it, just for your information. But my question to you is, did you look away and visualize it? Most of you will have done that. When you're trying to spell a word, you sort of look up and you picture it in your mind and you visualize it. What if your child can't do that? What if your child hasn't got the skill you just used to try and spell a word? How are they going to learn spelling words? They're going to learn it by rote. They're going to repeat things over and over again. And look, it's not enough to just say, picture it in your mind, picture it in your mind. You've got to track right back to preschool levels and rebuild that skill. But once it's built, it's phenomenally powerful. Here's an example of how powerful it is. Laura was in grade 3, terrible speller, awful speller. She could only remember one word a week, which is pretty bad for grade 3. We put her into vision therapy. When she could visualize well, how many could she learn in a month? She learned 155 words in her first month. Suddenly she has a vocabulary. You see how powerful this is? Give them a fish, feed them for a day. Teach them to fish, feed them for a lifetime. Give them the skill and they can do it themselves. So, as I wrap it up here, if you're struggling right now with a child who has dyslexia, learning difficulties, Asperger's, ADHD, or is just plain underperforming, this could be the best news you've ever heard. Now, I've given you a lot of information in this webinar, so you can look at your child and try and figure out what's going on. I've given you a couple of little exercises, but hey, if you don't commit to anything, I'm telling you now, you can rest assured that you will have a 100% chance of achieving absolutely zero for your child and changing zero for your child. You need to take a step. If you've never done therapy before, it might seem a little bit overwhelming, but hey, don't worry. This is simple, easy to follow games for your child that they'll love to do, and we target all the areas you need to develop in order for your child to learn effectively. We're with you all the way. It's powerful stuff, and I would urge you, be an action taker. Learning at Lightspeed targets these areas, and normally we will be charging $297 per module. Now, that's what each of these modules is worth to work with these specific areas. So we've got focus, eye teaming, eye movements, visualization, we've got laterality, hand-eye coordination, and a whole bunch of other areas, coding, sequencing, etc. Normally we will charge $297 per module, so that is $2,079. That's what we would normally charge. That's what it's worth. But we also have full support. So you get simple instructions, you get video demonstrations, you get email support, record sheets to monitor your progress. You get everything that you need to transform your home into a vision therapy center with you as the trained therapist. You get all that stuff. That's valued at $500 at least. So here's what you're getting. 7 modules for $2,079, full support, video, email access, all that sort of stuff, $500. Total value is $2,579. But before I reveal to you my special price, let me add some bonuses, because I love adding bonuses. And I love parenting books. It's fantastic to read. It can make a huge difference in your life and your children's life. So let's have a look at some of the bonuses. We've got the Involvement Informer. Nice little book, teaches you how to become actively involved in your child's schooling and make the right decisions. It's valued at $27. If you join Learning at Lightspeed today, it's yours for free. Bonus number 2, How to Raise Great Kids. This is 75 questions and answers on how to raise great kids. Whole bunch of these here. You might relate to some of these. Even the picky eater thing. There's many, many more questions. This is valued at $47, but for you today, it's going to be free when you join Learning at Lightspeed. Bonus number 3 is Raising Children Who Succeed. Great little book. How to define success, and then talking to them about what they do and don't need, and role models and all that sort of stuff. It's an incredible little book, valued at $37. It's yours for free. How about this one? Smart Parenting. Raising happy and responsible children in the 21st century. Encouragement, positive reinforcement. This is all great stuff, great parenting value here. Valued at $37. It is yours for free when you join Learning at Lightspeed. So here's what you get. 7 therapy modules, full email support, plus you get all 4 of those special bonuses. Total value $2,727, but you won't pay that much today. Stay tuned. You're not going to pay that much today, I promise. We want this to be affordable. But before I tell you our special price, let me ask you an important question. Can you do all this another way? I mean, can you get vision therapy, and how much does it cost? And by the way, this is not my program. I'm talking about other people's programs. Now, a quick check on the internet or in your local area will show you that most vision therapy, that I've sourced anyway, seems to be around $139 a session. Most optometrists recommend twice weekly sessions for 8 weeks, and they often recommend a second block a month or two later. Add this up, it's a minimum of $2,224 plus. Factor this in. You've got to factor in the cost for your time to travel to and from the doctor's office, your fuel, and snacks along the way. When you bring kids, you've got to call in a McDonald's on the way back through, which for 16 sessions at $30 a time, that's not unreasonable, especially if you've got food in there. It comes to $480 in addition. So the 16 sessions, or the 8-week block, including your $480 for extras, is $2,704. But remember, many times they recommend a second session, a lot of sessions. That is $5,408 or more. So for 8 weeks, $2,704 up to $5,408 or even more. Now, I'm guessing a lot of you out there don't want to pay that sort of money. And you don't want to take your child twice weekly to somebody's therapy rooms. That is if you can even find one in your area. And by the way, most of these therapies are designed to change optometry measurements, which is nice if it improves performance, but it doesn't always. It's a lot of money to pay for something that doesn't necessarily improve your child's learning. Let me explain this again. My exercises and therapies do not target optometry measurements. I want to provide tangible and observable improvements in your child's learning and reading. But what about other sorts, outside of vision therapy? Are there other things you can do for kids with learning problems? Now, many of you will have done some of these already. What about other doctors or medical professionals or educational professionals? Can't they help overcome dyslexia and learning problems? Well, yes. But before we look at that, dyslexia and learning is a huge and highly controversial area. You put 10 professionals together, ask them about dyslexia and learning problems, you'll get 10 different answers. And there's everything from pills to coloured glasses and all sorts of weird and wonderful things out there that are claimed to help. So which ones work and how much do they cost? Well, beware, I would say, of any miracle cures because they don't exist. Magic coloured glasses, magic drugs, magic movements, hypnosis, that sort of stuff. If you're pinning all your hopes on that, folks, you're going to be disappointed. You're going to have to do some work, I'm afraid. But the good news is we can give you the right sort of work to do. But let's have a look at some of these other solutions. In my area, I had a quick look. Here's some of the solutions that are suggested by educational people, right? I'm not even going to mention some of the more controversial treatments. This is what the educational people recommend and remedial reading people recommend. You could have your child assessed by a pediatrician who's a medical specialist who is likely to recommend medicating your child to help them learn with drugs like Ritalin and dexamphetamine. Now, outside of the horrific side effects of these drugs, including mood swings, personality changes, fatigue, a whole bunch of stuff, the cost of consultations and medications will usually amount to over $1,000 a year. Or perhaps you might say, I want to have my child assessed by a clinical psychologist who will do a WISCAR test and identify areas where your child is behind in age norms. They might offer a few suggestions of how you can help them, but there's no actual program to help. And there's a lot of this goes on because the schools often require it, but $550, you get a nice report and nothing to do, or very little to do, certainly not a program to do. Or thirdly, you can hire a tutor. But I'm afraid the bad news with tutors is, and tutors are great, remedial reading teachers are awesome, tutors are great. The problem is they're only doing what teachers and what you can do. They're doing it with more skill and knowledge perhaps than yourself, but you're all fighting the same thing. There is no skills. The kids don't have the tools to do this. That's why a lot of times reading tutoring is really slow and hard work and just arduous and painful. and you don't see huge results. I've got reading tutors in my area sending me children because we're getting stellar results with our kids, and it makes the tutor look great. If the tutor's plugging away there at, let's say, $90 a week, you want to get some results. So if they combine vision therapy with the tutoring, we get really good results. So at $90 a week, this would come to $4,680 a year. And once again, they're fighting the same battles you are. And you've got to get visual skills to your child. You've got to give them the tools, and then tutoring will work a treat. So the fact is, out there in the marketplace around the area for children with learning problems and visual dyslexia, there is no comparison. Doing something is better than doing nothing. And I believe we've got the perfect thing for you to do. It's not a quick fix. It takes time, it takes effort. But if you're willing to put the time and effort in, there is nothing else that can train the actual skills that your child needs to learn. So remember, I promised you that you would not pay $2,727 today. Today I have a very special offer for you. Why? Because I know what it's like to have a child with learning disabilities. I know the frustration and the pain. Because I'm passionate about seeing kids succeed at school. Nothing floats my boat and gets me more excited than hearing that kids are improving in their schoolwork as a result of doing our therapy. I love it, and we get lots of it. Because I understand your frustration as a parent, and I want to help you. Because I know most of you will do anything at all to help your child and save them from a miserable academic future. Most of you love your kids and will do whatever it takes. I understand that. So, normally $2,727 of value. You won't pay that today. Today, it's only $99.77 a month. For 9 months. $99.77 a month. So let's even make this cooler with some extra special mega bonuses, some more incredible parenting ebooks valued at $168, yours for free once again. Bonus number 5 is teaching good decision making. Now, lots of your kids need this. Help your child to make the right decision, and big tasks they can make the right decisions in. It's valued at $37, includes techniques and psychology tools. How cool is that? $37, it's yours for free. Bonus number 6, Asperger's Answered revealed. If you have an Asperger's child, or you suspect you do, learn the secret of how to understand them so you can bring the best out in them academically and in life. I wish I'd have had access to this book. It's valued at $47. I'm going to give it to you for free when you join Learning at Lightspeed. And finally, the child diet dilemma. Ouch. In our modern society, we are feeding kids the wrong thing, but you can learn how to feed them the right thing. Valued at $37, it's yours for free. And extra special bonus on the end, single parenting guide. If you're a single parent, we want to help you to navigate that. I'm throwing this one in as well because, we want to take care of you and because it's fun. Valued at $47, it's yours for free as well. So let's go over this again. 7 therapy modules at $2,079. Full email support and email access, $500 plus 8 incredible bonuses. That comes to a total of $2,875. But of course, you don't pay that. You only have to pay $97.77 a month for 9 months. You can drop out at any time, but 9 months is the full deal, and you'll get not only these amazing, incredible bonuses, but you will also get fantastic results with your child's learning. Let me finish up by saying this again. Doing something is better than doing nothing. Please do something to help your child. Give them the skills. Give them a fish, feed them for a day. Teach them to fish, feed them for a lifetime. And the longer you leave it, trust me, folks, the harder it is to catch up. And the more time and expense you will face. If you have a child in grade 1 or 2, do it now. Because by the time they get to grade 5, you've probably got to do a lot more work and spend a lot more money. And if they're in high school, you'll spend a fortune on tutors trying to help their grades. If you start early, we can clear it up now, give them the skills they need, and set them up for a lifetime of learning. So, give your child the skills that they need to succeed in learning for a lifetime. This is not a quick fix. It's a long-term commitment, and it will yield fruit for many, many years if you teach them the right skills. At only $99.77 a month, you can change your child's life forever. So finally, give your child the skills they need to succeed in learning for a lifetime. If you teach them the right visual skills, it will never leave them, and they will be set up to pursue academia long into the future and to learn effectively. At only $99.77 a month, you can change your child's life forever. You can conquer dyslexia and learning disabilities and give your child the chance to become all that they can be in learning and life. So click on the button and let's get started. I urge you to be an action taker for your child's sake, for their future's sake. Come on, get involved, check it out. I think you'll find it starts very simply, it becomes very powerful, and you can see your child moving ahead, perhaps even for the first time in their life. Come and join us. Take a chance, have a go, be an action taker. Don't sit around pondering it. If you sit around for 6 months thinking about it, then the program will be 3/4 over by now. If you really love your kids and want to help them if they're struggling with these particular problems, please join us. We look forward to seeing you on the inside, and we will catch you next time. Thank you for listening. God bless you, and I wish you all the very best with your child, both now and in the future. Take care.